Hello. We are here today with Dr. Kathleen Kan, a pediatric urologist at Stanford Medicine, and Dr. Chenxi Liu, who is the research lead in the Kan Lab, as well as our very own creative director, William Bottini, here at Stanford EdTech. And I am Claire Kulikowski, the lead instructional designer here at Stanford EdTech. Today we're going to be talking about Bladder Basics, which is a fully animated, engaging, informative, and most importantly, fun video series all about bladder health. Let's talk about your bladder, the part of your body that holds pee. Join Dr. Kan and her team, Bladdimir, Kai, Pediatric, Brain Javi, and Waterlupe, as they go on a bladder health adventure across 7 exciting videos, each just 5 to 10 minutes long. So we are going to kick our conversation off by watching a short trailer of this lovely project, and then we'll get into it.
Bladder Basics is a health education course that focuses on the bladder, the part of our body that helps us store our pee and empty it too. Bladder Basics is for everyone. You can be a kid, a parent, a caregiver, a family member, or even an enthusiastic friend. Doesn't matter. You may be someone who has struggled with pee problems before, or maybe this is the first time you're hearing about this issue. That's okay. I'm positive there will be something in this class for you.
So we're going to get Chenxi back up on the screen. Amazing. Fantastic. So we are so thrilled to have you all here today, including Bladdimir, who's in the studio with us. I wanted to talk about how this project came to life. I know that you really started this long time ago, a long time ago. And what brought you to EdTech, and what really inspired this version of the project?
Yeah, well, first of all, thanks for having us. We're really excited to be here. So, I see kids of all ages in clinic as a pediatric urologist, and a good portion of my practice is kids who come in saying, I'm having a pee accident, I'm having a poop accident, I'm struggling with my bladder. And I think after seeing a good number of those patients, I realized, hey, there's something going on here, because they're coming into my clinic waiting 6 months, a year for this visit. They're not getting better. And I'm spending the whole visit telling them about these healthy bladder habits that are most likely going to improve their symptoms. And they walk out of that clinic going, wow, I wish I had known this sooner, right? So I think that was really the start of, hey, there's something here for the community outside of my medical office that we can offer families and really start helping them. Yeah.
Amazing. And when did you start the Bladder Bootcamp, which I know was kind of how all of this started?
So that started, I think, in 2020, and it was an in-person session, right? Again, it was because we had patients literally lining up to our clinic saying, hey, we need this education, and there was no way for us to see every single patient individually, right? So we said, okay, we're going to make this thing, we're going to call it something fun, we're going to call it Bladder Bootcamp, and we're going to put about 20 people into a Zoom seminar. It was in person at first. So we're going to put 20 people into a room and, again, teach them healthy bladder habits. And then the pandemic comes around and we switched to Zoom. And actually what we saw was we have better uptake, more interest. There's something about being able to sit in the comfort of your home and learn these habits that people are really interested in. So that really started with the help of the clinical team. We expanded that through the pandemic into English and Spanish. And I think, again, we just kept on hearing great stories of, yeah, this is what I really needed. This is what my kid needed. And now we're doing better.
So just to reiterate, we started as Bladder Bootcamp, an in-person workshop. Obviously, during the COVID-19 pandemic, that transitioned to a Zoom workshop where we had a lot of positive feedback around being able to be comfortable in your own home. And, I can empathize. I feel like if I was learning about bladder habits, I would also want to be in my own home. And so with assistance and funding from the San Jose Auxiliary for Children, you, Dr. Kan, partnered with Stanford EdTech to start ideating bringing this virtual boot camp to life in an animated series. I actually was brought on to the team right after we started working on this project. And so Dr. Kan and William, I would love for you to chat about how it went from a live Zoom boot camp to this fully animated, beautiful story that we have today.
Well, I can share my memory, because this is an anecdote I tell people all the time. So just to back up, our team for several years, the thing that we really love to do and that I think we have a reputation for doing is creating character-driven, story-driven, artistic work that really just changes the game in terms of medical education. And we've been doing that with hand-illustrated, animated characters, almost like puppets. So when Bladder Basics or Bladder Bootcamp came about, in my role as our creative director, I'm kind of always just coming up with ideas. How can we do this? How can we make it as good as it can be? And sometimes that gets us into trouble, such as with the Bladder Basics. I said, well, what if this was a musical? Because the idea of creating entertainment for kids that is going to keep their attention in the home, my first instinct was, we have to really up our game. We have to make something that is going to keep their attention. And the idea of music as a way to communicate learning objectives and to recap the essential points was something I thought could be great. It could work with the learning design. It could work with what our team can do. And so I remember pitching the idea to you all in my bathroom, singing a draft of The Bladder is Part of the Body to everybody. And I'm not a singer, but I always tell people about this because I put myself out there just to see how it landed. And if it didn't work, it didn't work. But that was something I remember. And then you all were just so down to work with us and develop the whole vision together. So for me, that's the origin story.
I remember that. I remember that video or that moment where you were singing to us. And I think that it matched what we were hoping for, but we couldn't express, right? Like, I think we knew that we had this idea that was going to be really exciting. I think we knew we had a lot of young kids, right? But I think, again, in clinic, I don't have my guitar, right? Mm-hmm. I'm not trying to engage them in that way, but I've got them locked in because they're stuck in a room with me, right? But how do you get somebody who's at home with different priorities, lots of distractions to say, hey, I'm going to pay attention to this for 5 to 10 minutes, right? And I think the second you got all of our attention, I was like, oh, this is going to be really good. And I think the other thing is we had like words. That was like where we started too, right? From Bladder Bootcamp, we had realized that we wanted something to feel like inclusive, welcoming. I think we had like fun, quirky, like that initial brainstorm of the words we wanted when I see this trailer today, I'm like, oh, we have those words, right? So I remember that being a big starting point, and then saying, okay, we want songs, we want a story, we want something to connect it all together. Yeah.
Which I think is a perfect segue into, talking about how we centered the learner and how we wanted the learner to feel while they were watching this, especially because our learner population here, while of course we want the family members to watch it and people who can really be a support to our learners, our learner population truly is kind of this age range of 5 to 10, 11. And so having that learner population be our focus, I remember really thinking about Dora and Sesame Street and Bluey, like all of these really, really fantastic educational programs that have led the way for educational programming like this and educational content for this learner population. And thinking about what did we want our audience to feel as they participated in this? And Dr. Kan, I think one of the biggest takeaways that I remember is you talked with the participants of Bladder Bootcamp. And, there are a lot of mixed emotions for both our learner population and for their adults in their life around this topic. And so if you just want to talk about that a little bit and how we really came into this project centering those feelings.
Yeah, and I think that the biggest thing was that we wanted to make someone feel like their bladder problems were okay and normal. So maybe the word is normalizing. We wanted to normalize their experience, and we wanted them to feel like we've got you, right? Like we're here because we know this is common and we're going to get you through this in a really positive way. And I think that combats the embarrassment, the shame, the anxiety, right? All of those feelings, I think it combats that. And it's not just the kid that's feeling it, it's the parent as well. So I think that was sort of the core of what we were trying to do.
Absolutely.
Yeah, and you mentioned language before, and giving people a shared language. I think that was one of the great aspects of this course is that suddenly everyone can talk about this in the same with the same words and laugh about it.
Right.
Even, I think from the beginning of the course to the end of the course, it goes from something that's maybe embarrassed and stigmatized to like, oh, I hope everybody's out there singing these songs. Like, let's talk about pee. Let's talk about it. I remember, with when I first saw your script, like Chenxi, I remember working a lot with you about in the early days of you already had all of this language about inclusivity and normalization. It was all there already.
Yeah, I remember that as well. So I feel like that is based on the experience that Dr. Kan saw in her clinic. So like we noticed that the parents and the kids, sometimes they really struggling with the problem, and we don't want them to feel that this is a shame. So it's just like every kid may have some kind of chance to experience this kind of issue. So that's why, like in the course design, so we try to make it really related to the kids' real experience. We want them to see their own experience in the course. So it's like the Kai, which is our main character, like they're not perfect. They also have their own like the concern. And I remember one of the acts that we have is like the Kai is like they don't know what kind of food they should choose. Like we have the angel poop, and also we have the devil poop. And then the Kai need to make the decision what kind of food is really good for their bladder health. And we feel like this kind of situation may be faced by every kids. So that we really want to to make the content is relevant to the kids and the family. And also we feel like the kids from the different like background, they may all face this kind of issue. So that's why like we try to like to tell the story from the different angle, and so that every kids and every family they can see their own.
I definitely have an angel poop and devil poop, by the way.
We all do. I think that was also the joy of creating this course as adults. It was still so applicable to all of us.
I learned a lot.
I learned so much. Things that I quite literally still think about almost daily. I think, Chenxi, you bring up a really lovely, lovely segue, which is talking about the learning design of this course. And I'm realizing, obviously we have been deep into the design of this course for quite literally years now. But to give a little bit of context to our audience, we worked on this course from 2022 until the paper was published in 2024, correct?
Mm-hmm.
Okay.
Yes.
Till 2024. And now we are working on the Spanish translation. So we have been deep in the production of this for years now. But to kind of give an overview of what this course is, we have our, as mentioned, lovely characters, Dr. Kan, Bladdimir, Kai, Waterlupe, Putrik, and Brain Javi, who are in a school musical, and we see them solving these bladder puzzles throughout their school day. So the really fantastic thing is, as Chenxi mentioned, Kai is our human student who is having these bladder issues. And Kai's friends, Bladdimir, Brain Javi, Putrik, Waterlupe, help Kai to solve puzzles throughout the day at school, including thinking about what food is best for your bladder, or how many times you should be peeing throughout the day, or even just remembering to have your water bottle. And as they go through these videos, there are interactive pop-ups so that our learner at home, when they are on the computer, can interact with our curriculum, but also with our characters, as well as do some reflecting, which is really taking into account, how they are feeling when they start this course, or identify who is their support system, either at school or at home. Or once we kind of get to that food aspect, thinking about which foods are really good for your bladder health versus which foods maybe are not as much, right? And Chenxi did a really fantastic job of centering this design around the ARCS model and situated learning theory, and truly combining them in a way that is so interactive and really focused on our learner population. So Chenxi, if you want to talk about that a little bit, I would love to hear about those two models and how you really infuse them into this design.
Yeah, sure. I love to talk about this part. Yeah, so for the ARCS model, so that is stand for attention, relevance, confidence. and satisfaction. So this is the model that really focuses on motivation, because we know that motivation plays a very important role in shaping the families and the kids' attitude and the engage level. And also sometimes it's related to like how they want to follow the instructions along a way in their daily life. So during the course, the Kan Lab work closely with the EdTech and to bring all those fantastic ideas to life. So for example, like we want to attract their attention. So we have the songs at the beginning of the, each course, which is fantastic. And I even sometimes sing the songs at home, although I'm not a good singer. And then we have the interactive activities, just Claire mentioned, like they need to solve the puzzle throughout the course. So this is what the ARCS model about. And we do get the feedback from the families when we pilot the course. And the feedback we got is that the course they think is very engaging, and the kids, they love it. And they're very satisfied with the content. And they think that they're very confident to learn the bladder health related information by watching the videos. So like it feels like all the effort you put is really worth it. Yeah.
Yay.
Yeah, that's awesome.
Yeah.
And Chenxi and some other her colleagues at the Kan Lab team on the Kan Lab team did write a paper based on the amazing research that they did. Honestly, as an instructional designer, it was so fantastic to also be able to partner with another learning scientist while we designed this, so that I could really focus on the course and Chenxi could really focus on the evaluation side of it. Because another thing that was really important to us as we built this, especially since so much time and effort and funds went into this project, is we want to make sure that it has efficacy and that we can show that all of this was worth it for our learners. And I'll let Chenxi tell you a little bit later on, but we absolutely completed and accomplished that goal, especially based off of the data that we got from the study. So we can chat about that a little later. Something I wanted to talk about in terms of our collaboration as a team was, I think we can just start by talking about what is your favorite memory of creating this content. It could be your favorite memory of William being in the bathroom and singing, or just a way that this team collaborated to create new ideas, or maybe something that kind of came out of nowhere that we didn't expect, but we absolutely loved. Dr. Kan, I'll start with you.
Well, yeah, I mean, that memory of William is definitely a good one. And I think my favorite memory is actually, it was summer of 2022. And I was so excited about this project. I had scheduled a vacation with my family. And I think we were in France. And I was so excited that I was logging on to our meetings at midnight France time. And it was so energizing. And so I think my family was like, what is happening? She is on a Zoom from 11 p.m. to 1 a.m. And then we would finish our day traveling, and I would run all of the script edits by my family. I would act out all of the parts to be like, does this make sense? Am I missing anything? And I think for me, it's just a very fond memory because I was so excited about the project. It was really about to become real life. This was before we were just doing the script. I was starting to see the whole picture. And I think every single part of the process, we ran by lots of people, right? From start to finish. I think we kept on going back to people who had no idea what this material was and saying, does this make sense? Are you learning something? Is this fun? And so to show my little cousins that material at the beginning, things like that, is definitely a very fond memory.
William, I'm going to swing to you.
Okay, well, I already mentioned one. I guess in my role, I, at the time manage our production team and, lead the creative aspect of the work. And I guess I saw this project as a way to do something that I think everyone on the team really wanted to do. Because our teams is a little unusual. We have artists, we have illustrators, we have filmmakers, and this was a project that could enable us to all grow and also do something really great for people at the same time. So I guess my favorite part was, I guess, being in the mix, looking at, for example, Kat turning our sketches into the real Bladdimir, and in fact also working with our team to get the dolls made and to design the dolls, and then working with Hui to design the technical workflow, because we had to invent this to make this happen, and working with Grace on casting. That was a lot of fun. Listening to all of the auditions, recording with people literally all the way around the world. I mean, I think there was only one person in the US, maybe two people in the US that we recorded with. I guess my joy was just like seeing it all come together. Like, oh my gosh, we really set ourselves out to do something big, and it was great, and all those details really do matter. Like every word of the script, I think we went over a zillion times, and the lyrics, it's like, how can we take a 10-minute thing and turn it into 45 seconds? I guess I was just really happy that our team rose to the occasion.
Yeah, and I will add to that. In hindsight, as we think about this project, but also how our team works together now and the projects that we are working on now, this project, I think, really laid the foundation for our team to know that we can make something really successful while also trying a lot of new things, because it truly was a collaboration of us all saying, y'all's team and our team together, we don't really know what we're doing here, but it's going to be so much fun. And I think that spirit of collaborating with your team, and especially bringing this project to life, I think has really pushed us forward as an EdTech team to continue using that creativity, but also being okay with, this is going to make this project really cool. Even if we don't know how to do it right now, we're going to figure it out, and it's going to be great. So I love that. First of all, I have to give so much credit to William for really being the creative push on our team. And also, I think, just the creative motivator of saying, this will be worth it. This is going to be hard, but this is going to be so fun, and this is going to be so worth it. Because he continues to do that to this day with all of our projects when we're all a little bit scared. William always pushes us forward. So this project, I think, really sparked a lot of that creativity. I'll quickly say that my favorite that I talk about all the time with this is each of our characters we defined as either a mentor character or someone who was learning with our protagonist, Kai. And so creating those personalities based off of what role they were playing, how they were interacting with our character. And, I think even on the other side of when parents are trying to communicate with their children using this new shared dialogue, who will parents identify with, right? That's Dr. Kan, that's Pediatric, that's Bladdimir, versus who can we refer back to as a learner and say, remember Waterloo Bay left, went somewhere during the day and Kai didn't have their water bottle. We have to think about where they are and how we can be responsible there, right? So I think defining those characters and also creating diversity within a cast of a brain, a bladder, a poop, a water bottle. Really, I remember having multiple meetings of just names upon names upon names and, talking with the Stanford DEI office and talking with our learners and talking with our learner populations and our community advisory board to really make sure that even though we don't have a ton of visual diversity here, how can we represent diversity? And we did that through the names of our characters, which I think was maybe one of the most fun processes because it was just fun. It was so enjoyable to just have everyone put out the names, no matter how silly they were, and come together and create these personalities. Chenxi, I'm going to pass it to you.
Yeah, so I really want to echo you on this, and this is also one of my like the key memories, I would say, for this project. So actually, this is also the first project I worked on. So when I joined the Conlab, so I really enjoyed it. And I still remember that actually we did this from the scratch, right? So there's nothing and there's no kind of project like this. So this also, like, based on our knowledge, this is also the first public available resources on bladder health and for the kids and the family. So we were thinking about like how to name the course. Originally, we have the name, I think it's a brief, and then when we talk about the brief, so what the people will think about it is not very clear what the course is about. And then we imagine that when a physician and to refer the course to their patient at the clinic, what they gonna say? Please watch brief or please watch Bladder Basics. And then we decide we will choose Bladder Basics as our course name, and also the name of each characters. And it's really fun to brainstorm how we want to name them. It's just like a very, very good memories for me. And also, I remember we asked our community advisory board and to review the course content again. So it's not like the one-time thing. So the whole development process is really an iterative process. Like we talk about what we want, and then we develop sample or demo and let the people to review it. We got the feedback, and then we improve it. We revise it. So I feel like now it seems like all the things that we have been dream about in the stage one, I will say, because there's a lot of things we want to try in the future, but at least in stage one, I can say that they're coming true. So it's really amazing. And another memory I want to mention is I present our Bladder Basics with Claire at AERA, so which is a national education conference. And we got a lot of feedback and the questions. So the people keep asking us, like, how did you design it? And how can you create this? And how many people involved in your team? And how long it took to bring the project to life? So I feel like maybe my memory has biased, but I feel like our presentation is the presentation that got the most like got a lot of questions in that session.
Mm-hmm.
So it's like, I feel like we really got people's attention and they really love our project. Yeah. It's like my baby, so maybe I'm biased.
No, Chenxi, I have the same memory of, the room opened, everyone was done speaking, and it felt like people were swarming Chenxi and I. And we had stickers, of course, so I'm sure that helped. But yeah, I think just feeling, especially when you're presenting at a really big conference, especially like AERA, which is a lot of learning scientists, a lot of professors, a lot of people who do education research. It felt very intimidating, and to be able to feel the excitement from people who hadn't been building this for 3 years, it just reinvigorated us, I think, and made it feel that much more special. And that other people were really excited, not only about this project and the outcome, but all of the work that we put into it to make it as well. So really what I want to ask you, when thinking about working with EdTech and this whole process of coming to EdTech, ideating, creating, iterating, and having this collaboration. If someone at Stanford or beyond wanted to attempt something similar, what lessons learned, or if we did this again, reflections would you share?
Okay, so I actually do get asked this question in real life because I do think every clinician who sees Bladder Basics or hears about Bladder Basics is like comes up to me and goes, how do I do this for my patients? So first of all, I'm very lucky to have Chenxi, right, who has this background in education design. So I think from the very start, the advice I would give is, if you're a clinical person, right, speaking from that perspective, you have to break down the overall goal of what you're trying to do. Like, what's my North Star? And so for us, it was, I want to teach all kids, and generally kids who are having the current clinical issue, but all kids about bladder health. If I could just reach as many kids as possible, that's my North Star, right? And if I could change behavior, that'd be like extra great. So once you have that one goal, how do you break it down into components with a clear objective? And I think that's really hard when you spend all day talking to patients, because you kind of just say all the things you want to say and you're like, okay, goodbye, come back and let's see what you've done, right? But to break it down into an achievable small goal, and then break those goals down into even smaller pieces and like parts that are going to achieve that goal. I think that's the advice I would give, which is the outline, that first outline of what is your overall goal and what do you really want your learner to walk away with is probably the most important, because then you're going to spend all this time revising it and you want to be able to look back and go, okay, yeah, we hit our goal. And I think that's how we all feel. But that first part, which feels maybe tedious, is actually really, really important. And that's why Chenxi's like, the best, because she was able to take all of my, like, here's all the things I want to do and break it down into those clear objectives.
I'd say that's really similar in on the creative side too. If you were gonna say, hey, do you want to make an hour-long musical, and it's animated, and it's about pee, that sounds wild. But when you break it down into, okay, well, if there was a character, who would the character be? Oh, maybe it's a sketch I can draw in my notebook while I'm on a walk. Talking about this with my wife while we're on a walk. Like, oh, what? Let's workshop some lyrics. suddenly, like when you look at the small pieces and the pieces that your team is really capable of, like when you lean into everyone's strengths, you can put that puzzle together. And I think that's what we did in the same way, is think about what's possible with the people around us, and what can we all learn, and let's learn by doing. And suddenly we go from, we're a team that's never made an animated cartoon musical, to now we have these dolls. And we, as an EdTech team, we did everything we could to make sure we had enough time to do this. We went above and beyond because we just loved this project, and we just loved working with you, and the trust that you put in us. And so we, in the background, we were like, okay, how can we justify all of this extra time that it takes to actually learn how to do these things, because it's growth for our team too. So I think just, if you really care about an idea, you can break it down into pieces that are achievable, and you can find a way. You can find a way to make it so that you have time, if you lean into the strengths of your team. So that's what I would say.
Chenxi?
Yeah, so I would say one big lesson I learned is that the audience voice is really matter. So it's really important to listen to the people's voice that you are designing for. So it's like throughout this project, we have talked about families, teachers, and clinicians, and also like we try to understand their needs and their experience. So I would say their feedback really shaped the many decisions in this program, and help us to make the content is more relevant and useful for the people that we hope to support. And another lesson I learned is that collaboration is really important. So it's like I feel like I really appreciate I have the opportunity to work with EdTech and also join ConLab to work on this project. And also throughout this project, Claire also mentioned, we talked with the DEI office, and also we also talk about, I think, another department from the university about the branding. So how can we align with the requirement of the university? So it's just like you work with different group, and then each group, they will have their different perspective, and you bring everything together and to put those insights together and to help us to design the course. So yeah, so I would say, yeah, I really appreciate those 2 points.
Well, I will wrap us up just by saying that something I think that EdTech does exceptionally well, which is, I guess, our job. So I'm happy that we do this well. But I like to explain, when people are interested in doing a project like this or like anything, that if there's a vision and there is a dream, our job as EdTech is to really help define that dream, similar to what you were saying, Dr. Kan, really understand what the outcomes are. And then also, I think, really look at a production standpoint and also a learning science perspective of what modality is the best way to do this for our audience, right? And that's looking at the feedback from physicians, the feedback from whoever our learners would be, looking at those outcomes and what we want those outcomes to be, where it's going to be hosted. Is it going to be live? Is it going to be on YouTube? Is it going to be interactive? There are all of those different variables that you really need to identify before you even start thinking about what the end result will be, because those variables should dictate how you are creating the end result. And I think this is such a perfect example of having a big dream, maybe feeling like we're a little bit out of our depth at points, but knowing that it is the best way to do it for our learners. It's evergreen material, which means it's not going to change. And that the way to engage our learners to create efficacy, it is worth it to invest this time and effort and skill to create something beautiful. And I think that you can take that idea and you can transition it even to any project, even if it's just creating a checklist, right? It's about intention. And I think really what this team did so well on every level throughout, especially with Dr. Kan leading the way, is being so intentional about everything that we talked about, everything that we designed, all of the people that we talked to for feedback, and even as far as thinking for when we launch, how do we want people to view this course as a whole package? And so that intention, I think, is what made this successful, and I think is truly what can make most projects successful. So with that, thank you so much for joining us today. I had such a great time talking with y'all, and I hope to do it again so soon.
Thanks for having us.
Thank you.
Thank you for having me. Thank you for having us.